everybody know. We are going to go ahead and start off with our tutorial this week. That is Dr. Danielle Davidoff. She is an associate professor at the School of Public Health in the Department of Social and Behavioral Sciences, where she mentors students of all levels. She holds a secondary appointment with the WVU Department of Emergency Medicine. Her program of research centers on using qualitative and mixed methods to address intimate partner and sexual violence in home visitation, healthcare, and college settings. She is currently the co-lead for a PCORI-funded project with the West Virginia Coalition Against Domestic Violence, and she has served as a qualitative lead and co-investigator on numerous statewide evaluations to improve health disparities related to substance use and mental health in West Virginia. This session's tutorial will be how to ask a qualitative question. Danielle, I'll go ahead and hand things over to you. Thank you, Dr. Davidoff.
Thank you so much, Jen. I appreciate it. I'm excited to be here today to talk to all of you. Would I be able to share my screen? If so, I can bring up a few slides that I have for today.
Absolutely. Let me work on that right here.
Thank you. All right, well, thank you for having me here today. I'm really excited to talk about any and all things related to qualitative research because that's sort of my bag. I like it. I like qualitative work. And especially when it comes to research in health sciences, we know it's really valuable, but it's not necessarily used as much as it could be. So I'm excited to share with you today, and I'm going to just get right into it. So before I launch into talking about how to ask a qualitative question, I just wanted to revisit and bring up some of the main differences in the objectives of qualitative and quantitative research. So just as a refresher, if you have worked in both of these domains before, or maybe you're new to them, quantitative research and work is really meant to be explanatory. When we use quantitative methods, we are sometimes describing, but when we're describing something, we use numbers and percentages and frequencies and things like that to quantify data and what we're interested in. We can do prediction with quantitative methods. Predict if X leads to Y, or if things are associated with one another. And with quantitative work, we're really interested in hypothesis testing. And we can use qualitative research in conjunction with quantitative research to further explore things that pop up and seem interesting in our quantitative work. On the other hand, qualitative work is meant to be exploratory. We do describe things, but we usually do that using words and quotes from participants instead of numbers. We can provide important and valuable insights in qualitative inquiry, and we're really seeking to understand versus to predict or to determine how things might happen together, for example. Qualitative inquiry is supposed to be hypothesis generating. So we'll talk today about how when we form a qualitative question, we're not really going to use hypotheses. Instead, we are going to talk about what our aims or our objectives are. And we can combine qualitative research with quantitative in many ways. One popular way is to take what we learn in a qualitative study and then use it to generate a theory that can be tested in a quantitative study or a quantitative analysis. So now that we have covered that, I'm going to move into the types of qualitative questions that I'm going to be talking about today. So, when asked about how do you make a qualitative question, there are two ways that kind of goes in my mind. And I'm going to really quickly turn off my email because it is just buzzing and beeping, and I know that's getting picked up in the recording. So let me get rid of that and start again. Okay. So there are two main ways we can ask qualitative questions. The first way would be in the same way we might ask a quantitative research question that would guide a study. This could be similar to a specific aim, an objective, or maybe a hypothesis in quantitative research. Usually you'll have one or two of these in a given study. But also when I think of qualitative questions, what comes to mind for me is actual questions that we ask when we're talking to people in qualitative data collection. So I'm going to be covering both of these today very briefly. I could have an entire hour on each of these very easily, but I'm just gonna, kind of give an overview of the basics. And then if we have time at the end for quick question and answer, we will definitely get into that in more depth. So qualitative research questions by nature are supposed to be, and really I'm talking now about qualitative aims or objectives, they're by nature inductive. So that simply means we usually don't go in knowing what we're looking for. So they're supposed to be exploratory. We don't come at our research qualitatively with preconceived assumptions or hypotheses. Also, many times in quantitative work, we have a directional hypothesis where we predict something will be positively associated with something else. We don't do that in qualitative work. So often what people do when they write a specific aims page is they will say, well, we have this qualitative aim. What is our hypothesis? Is it that we expect that we're going to find certain things? And usually I advise people not to use a hypothesis with a qualitative aim because we're not testing hypotheses. It's not to be done. It can't be done with qualitative research. So a hypothesis is not really appropriate. However, sometimes reviewers want that. So I tend to over-explain why I don't have a hypothesis, just with a simple sentence that might say, because this is a qualitative aim, we do not have hypotheses because qualitative inquiry is not meant to be hypothesis driven. And then you can go ahead with your qualitative objective. So that's one way to kind of get around quantitative oriented reviewers. So some topics that are really well suited for qualitative research questions. Anytime we want to learn about the context behind any type of behavior or issue or environment where we might be going to create or implement an intervention, qualitative research is a great option for us. So an example here would be implementing a new medical record system in a clinical setting. We might need to know the context behind that clinic and what things have been like over the years in terms of medical records to see if a new program would be feasible. Anytime we're interested in something really complex like social processes, how humans interact with one another, how relationships form and are carried out, qualitative research is great for that. Anytime we want to know about patients' perceptions or their lived experiences, qualitative research is the way to go, right? When we want to ask, how do things happen? How do things go? Why did you do this? What would you do in this scenario? Then qualitative research is great. And so again, anything that underlies behavior, why someone does something, their beliefs, their values, their opinions, their preferences, qualitative research is really great. We could begin with quantitative survey research, but we as researchers might not come up with all of the preferences or reasons behind something. And so if we give someone a survey, really we might not be capturing the breadth of their experience. So qualitative research is more appropriate in that example. And then, especially in health sciences research, barriers and facilitators for behaviors, for just about anything you can imagine are frequently used in qualitative research. So often the research I work on, we tend to focus on general experiences of something. Maybe that's a program, maybe that's a healthcare provider's interaction with a set of patients, and then barriers and facilitators to whatever that thing might be. All right, so I'm going to get right into writing qualitative questions. So there are some really simple rules that we can follow when we are writing a qualitative objective or an aim for a grant, for example. And the way we form our question and making sure it has appropriate boundaries and scope is really critical, because that will determine who we speak with, who we talk to, and what analysis techniques we're going to use, as well as what we can say with our data at the end of the day. So a good qualitative research question will focus on a single idea or concept. So it won't be, we're going to talk to everyone about everything going on in their life, right? We want to narrow it down to something really specific about an individual's experiences, for example. Good research questions also start with a verb, and these verbs are very different than what we see in quantitative aims. So typical qualitative research questions start with verbs like to characterize, to describe, to understand, or to explore. There's really exploratory things. We always use neutral and non-directional language. So we are not going to only look at things that work or facilitators, for example. We usually balance it out with barriers and facilitators, or all experiences versus just good experiences, for example. And then in our aim, we also want to define our sample, so who we're going to be speaking with or including in our research, and then the setting where we're going to recruit or talk with individuals. So here I have some qualitative buzzwords that you may use, and these are words that can be used both in questions that we ask to people or in research aims that we might put in a grant application. So if you find yourself writing and you have words like cause, effect, influence, impact, determine, examine, these are really quantitative terms that we typically and technically do not have the ability to do. We don't have the ability to examine cause and effect with qualitative work. However, we can explore how and why things happen, what things look like. We can identify things, describe them, assign meaning, and talk about people's experiences. So these words on the left-hand side are really more qualitative. So I would, put it to you all to, as you're writing, if you need to write something qualitative, try to go in and see where you can replace, if you have very quantitative things, to more qualitative terms. All right, now we're going to just quickly look at some examples of actual research aims. And I just want to give a shout out that these come from a YouTube video that was put out by a researcher named Leslie Curry for Yale University. And she's done a whole lot of work on qualitative research in clinical settings and in the health sciences. So her quick videos were really, really efficient and helpful. And I thought, well, I'm just going to borrow those for today. So an example that she uses really clearly shows this structure of an aim where we have a verb plus our very specific topic or idea, and then our setting and our sample. So in this example, we have a qualitative aim that is to understand interpersonal and system level factors relevant to delivering healthcare to emergency department patients who are homeless. So we have our verb to understand, and it's appropriate qualitatively. What do we want to understand? Factors at the interpersonal and system level for delivering healthcare. And then our setting is emergency department patients, and the sample is that happen to be homeless. So that kind of fills all of the criteria, and it's really specific. Two more examples are to characterize the experiences of individuals in key healthcare leadership roles in sub-Saharan Africa. So again, we have our verb. What are we going to do? We're going to characterize. What are we characterizing? Experiences of individuals in key healthcare leadership roles, really, really specific, right? Not too broad. And then where in sub-Saharan Africa. And then the second example is to identify. That's our verb. What do we want to identify? Hospital discharge processes that are associated with better performance in AMI care as measured by mortality rates. So this one was probably an aim associated with a mixed method study where individuals maybe had some data from their hospital on mortality and wanted to say, well, in those instances where mortality was high or low, what did hospital discharge look like? And maybe they qualitatively grabbed that information, maybe from the medical record, maybe from interviews. And so you can see there's some quant stuff probably built in there, but really what they're doing is qualitatively exploring what's going on in that healthcare setting. And here's a qualitative question that we can look at to critique. So this is an example that Leslie Curry had in her video that someone brought to her that was her student. And they were interested in contraception use, and their drafted qualitative question was that the purpose of the study was to understand knowledge, attitudes, beliefs, preferences, and barriers for contraception use among women. And so there were several issues with this question. One is that it's a little bit broad, right? We have a good verb, which is to understand, so that's great, but we're trying to understand just about everything related to this topic among a very broad group of people, women, right? So this is not a very narrow or specific question. It would be really hard to figure out where the boundaries of this question were. So to revise it to look better, we might say the purpose of this study is to characterize barriers, so pick one of those things, to contraception use among young Latina women at high risk for unintended pregnancy. And so here we can guess that this person combed the literature to find that that might be where a gap exists. And so this characterization of barriers can really add to the literature. If we know a lot about this population's knowledge, then doing qualitative research in that area isn't going to be necessarily useful. Just like with quantitative research, we want our qualitative question to fill a gap somewhere. Okay, so I just wanted to very, very quickly touch on interview guide questions. So let's say you have your qualitative research question or your aim or your objective, and now you ask yourself, I have to create an interview guide to talk to people and hear about their experiences or their preferences. So how do we do that? So it's similar to the process of creating a survey, right? Do we go from scratch? Do we find something that exists? And the answer is almost always in qualitative research that we create our interview guides from scratch. There's no such thing as a valid or reliable interview guide. We base our questions on what we want to know, and then we construct them using a few rules. And we usually interview people to ask those qualitative questions. And so we do that because we need to find out from folks what we cannot directly observe. Right? And so we're going to ask qualitative questions when we need to talk to people about their feelings, their intentions, behaviors, and what the world around them means. We need to enter into their perspective. So asking good questions is truly an art, but some hallmarks or rules that we want to follow when we're creating questions to ask people within maybe a focus group or an interview are that we always want questions to be open-ended. We want them to be neutral, singular, and clear. And so by open-ended, we simply mean that we do not want questions to start with words like, did you, have you, will you, can you? Instead, it should be, can you tell me about, or what was it like, or how would you describe, right? If you can answer yes or no to it, we don't want someone to, we don't want to ask that question. By neutral, I don't mean that we have to be a robot when we're talking to people, but we just want to be neutral with the information that we're talking about, not necessarily our rapport or our the way we're talking with people. So we don't want to say, you are giving me exactly the kinds of information that I'm looking for. We want to instead say thank you for that information. It's really helpful. Not, oh, you've told me exactly what I was thinking that I was going to find in this study, because that could lead the participant. Just as in survey research as well, we don't want double-barreled questions. Can you tell me what's good and bad and hard and easy about your job? Instead, we want to say, let's talk about what successes you've experienced lately. Okay, now let's move on to challenges. So we want to give folks one thing at a time to answer. And then we want questions to be clear and make sure that we are speaking in the language and terms that make sense for the people we're talking to. And that might be using jargon or lingo or words that make sense to them versus what we might call them as a researcher or academic. So an example in my work is I research intimate partner violence. That's kind of an academic term. Most people that either support those that experience intimate partner violence call it domestic violence or abuse. And folks that experience it themselves don't usually call it intimate partner violence. So we pick the language they use, which might be DV or abuse or domestic violence. And so I will use those terms when I'm talking to them. So just very quickly to end on some rules for qualitative interviewing, we want to have an open-ended style and have active listening techniques as we are asking our questions. We want to avoid leading questions, let the informant lead and have a conversation with them. We as the asker or interviewer should be talking very little. And then the hallmark of really talking to people and asking questions in qualitative research is probing. And probing is simply, whenever we ask a question, a person will start talking to us, and then we ask them to tell us more, and then more, and then more. So you mentioned this, can you tell me a little bit more about that? Oh, could you give me an example of that? That's really interesting. You know, and really kind of validating what they're saying and encouraging them to give you a little bit more information. So probes are a really important part of qualitative inquiry and discussion. And so I just wanted to make sure to give some examples of those here. And these are built into your interview guide and your instrument that you use to talk to people. Okay, I'm sure I'm right at my time, or if not over. So I'm going to stop there and see if anyone has any questions.
Thank you so much, Dr. Davidoff. That was truly wonderful. And we appreciate the PowerPoint as well. That is something that we could also include within our recap information that's sent out on conclusion. Is there any type of feedback or questions that may be outstanding for her?
Yeah, I'm seeing one in the chat that asks if there is a growing need for qualitative research. And, you know, I can definitely say, and I'm biased here for sure, there's definitely a need for qualitative research. And the reason behind that is that if we look, especially with healthcare research, such a small percentage of research that we do actually makes it into practice, something like less than 20%. And it takes decades for research that we do to actually be adopted and used in practice, even when it is adopted. So one way to make our research and our interventions and our programs more adoptable, applicable, and appropriate is to talk to the people that are going to be using them or implementing them to make sure that it is culturally appropriate, that it makes sense, that it's a good fit, that the place is ready for that program. By just simply taking a top-down approach and kind of forcing our ideas on people as researchers or practitioners, we're almost ensuring that it's not going to be a long-lasting thing. But by encouraging folks to come together and talk and kind of pick apart something qualitatively at the outset, we have a much increased likelihood that something will stick around and might be successful. So it's sort of like the hallmark of qualitative research is more of a bottom-up approach than a top-down approach in general. And if we apply that to healthcare clinical settings, you know, research with people in general, where we're trying to improve health and well-being, we almost always have a better chance when we involve them from the outset. Great question.
This might be beyond the scope of the conversation today. First of all, I'm Jennifer Boyd. I was late today, but I thank you so much for the presentation. It was really good. Any succinct pointers you could give about, say, the difference between interviewing a person as an individual versus in a focus group?
Sure, absolutely. Yeah, there's just a few very simple things to keep in mind. I would say the main one that you want to think about when deciding, do I get people together in a group to talk to me or do I talk to them one-on-one, is the content of what you're going to be talking about. So typically, anytime you want to get a lot of depth on something, such as a person's journey or experience, or you really want them to just take you down the path of a particular issue, you're going to want to talk with them one-on-one. But anytime that it's important that you get a lot of perspective in a short amount of time, and you really need people to interact with each other to have that really great conversation, a focus group is going to be better. So typically, like in my work, for example, if I want to know about an individual's experience with domestic violence, because that's a sensitive topic, number one, and because I want to really dive into that person's experience and journey, I'm going to want to do an individual one-on-one interview. But if I want to talk to healthcare providers and find out what it's like for them to screen for domestic violence in their practice, a focus group is going to be great because they're going to build off of one of each other, and that conversation stimulate, like you want dialogue to stimulate further and in-depth discussion. And in a focus group, you get more information from more people in the same amount of time as an interview. So when money is an object, or when money matters, which it always does, when travel is an issue, it's more efficient to do a focus group a lot of times. But we want to make sure that the topic isn't super sensitive if we do that. That being said, I have done focus groups with women in treatment for opioid addiction at the Coat Clinic at WVU, and they are so used to that type of environment of sharing their experiences in a focus group or in a therapeutic setting that it was fine. They weren't at all like, this is too personal. They told us everything. So there's not like a hard and fast rule. It just depends on the question and the audience.
Thank you very much.